Welcome to Families in Action on your hometown station, AM 1220 KHTS. My name is Cary Quashen. I'm your host, but I do not host this show by myself. I host it with Mike Doherty, a.k.a. the Silver Fox.
Hey, how you doing, Cary?
I'm good, Mike. How are you today?
I'm good. I was going to ask you what you did this weekend, but I know what you did one of the days this weekend. We'll be talking about it.
What did I do?
Oh, you know what? That drug take-back thing that we did at the hospital.
That was awesome.
Yeah, we were out there.
A drug. Every few months we do what you call the drug take back, and we tell people go into your medicine cabinets, get the drugs out of your house, and let's get rid of them in an appropriate, safe way. Because a lot of people, they're flushing these pills down the toilet, they're leaving them in their medicine cabinets, kids are finding them, people are overdosing, and we want to bring attention. And we got 200 pounds of narcotics out of people's medicine cabinets. We filled up 10 boxes.
And that was a not only Action, but it was also Henry Mayo.
Yes.
KHTS radio.
Gazette.
And Santa Clarita Gazette and the sheriff's station.
And
local
the DEA.
And the DEA was there. Yeah, it was a great time. My wife came along and helped out. Mary was there. And, just to help everybody
Dusty
understand.
and her family, some kids from my
absolutely,
group.
we did.
Really
the
neat.
pharmacy lady from Henry Mayo.
Yeah.
And what happened in September 2015, there were more than 3,800 federal, state, and law counterparts who took in more than, this is nationwide,
Listen to this.
702,365 pounds of unused, expired, or unwanted drugs in over 5,000 collection sites. So this is a good thing. So we got like around 200 pounds.
You know how many people we were saying, as you were there, thank you, and then people say no thank you because we don't know what to do with these drugs.
Exactly. And we should probably tell them.
Yeah, we should, and we're gonna. But a lot of people, they get sick, they have pills laying around, somebody had cancer, unfortunately. We had literally people bring bags of narcotics because people were sick in their home and they had pills left over, and they don't know what to do with these things.
No, and I heard everybody say that. They were glad that we were there because they didn't know what to do with them. And, of course, you can take them at any time to the sheriff's station.
That they have it's kind of like a mailbox.
They do.
It's sitting out front, and no questions. Nobody comes over and asks you anything. You just put them in there, and they dispose them.
And if you can't get to the sheriff's office, you can take them to the fire department as well.
Yes, you can.
Because they know what to do with them. So don't flush them down the porcelain convenience because we don't want the little fishies to be getting that stuff.
No, because we might eat those too.
Well, we might, and we don't want that problem.
Yeah.
Hey,
and by the way, don't leave them around.
No.
If you have prescription pills and they're in your medicine cabinet and you want to keep them for a rainy day when something might happen, put them in a safe. Lock them away. Get them away from your children.
That's true. That's true.
We're losing, as we were saying earlier, this is an hour show. Mm-hmm. How many people are going to die from a drug overdose by the end of this show, Mike?
3.
3 people in this country will lose their lives.
For a fact.
Will lose their lives for a fact by the end of the show.
Yeah.
3 people will die.
In fact, that's an action file item. We'll talk about it a little bit more. Hey, I wanted to ask you something. We have some very, very important people that bring us this program.
I was just going to say we didn't
say a thing about it.
I'm going to let you do it today.
Brought to you by Action. This is Families in Action.
It is.
And it's brought to you by the Action Family Foundation. Brought to you by KHTS AM 1220, your hometown station, who has been bringing this show to everyone here locally for 13 years.
Oh, wow.
Just about. Wow. That's a great one. But you always ask me to talk about the Action Foundation, and I wanted to talk about something that we don't usually mention about that. We talk about the Experience, which is the moving memorial.
Right.
That's going to be out in
we
the not too distant
We talk about Action Family Counseling, which is alcohol and drug rehabilitation centers that Action has, and we deal with intensive outpatient, residentials, you name it, we do it, interventions, all kinds of stuff.
And the Action Family Foundation also has the free parent support group every Tuesday, 7 to 9 at Canyon High School, which is a fabulous thing. You do. You are the guy. You're there.
Yeah,
You're there every Tuesday.
If you think you might have a problem with your teenager, show up.
And here's the one that I wanted to mention that I was talking to you last week. I said, Cary, we haven't even brought this up, and that's the Action Academy, the free public sober school for local junior and senior high school students. Cary, that's a great deal.
It's a joint venture with the Hart School District. and Action Family Counseling, and it's middle school and high school. We're serving 12 kids right now, getting ready to expand, and it's a safe environment for kids that really don't want to be around all the other craziness. The kids that are trying to stay off alcohol and drugs, and it's a sober school. They have counseling. There's academic stuff. There's drug testing, and it's really what a neat deal it is. It warms me up to think about it.
Me too. What a fabulous resource for the parents out there if they're looking to say, what am I going to do?
Yeah, well, especially we have kids trying to stay clean. Think about this for a second. If you needed help, you're an adult, I do an intervention, throw you in rehab, you get out in 30 days, you got a loving wife, a job, and a lot of support. Now take a 15-year-old.
They're lost.
But all of a sudden you found, oh my God, my kid's using drugs. He's been using 15, 16 months. That means everyone he knows does. Goes into rehab for 30 days, comes out, and he's got peer pressure times 100. So the sober school that we have is a way that he doesn't have or she doesn't have to deal with that peer pressure. Everybody's sober.
Let me ask you a question, Cary. If somebody was interested in looking into that for their child, how do they get in touch?
You go through Hart School District.
So they just call them.
It's called the Action Academy, and say, I want to get my kid. Right now, unfortunately there's a waiting list, but get your kid on that list. Call the Hart School District.
It's worth it.
Oh my, is it worth it?
And they can also find out more about the school by calling as well.
They can do that. You can also call 1-800-367-8336. That's Action, and we can
say that number one more time.
1-800-367-8336. Hey, Mike.
Hey, you know what I was going to do?
Why don't we introduce our guest?
Okay.
Then we'll do all that stuff.
Okay.
Let's drag her in and make her part of this. What do you think?
Oh, okay. That's where
I'll let you do that.
And this is interesting because I talked to her, and I'm going to tell you her name in a moment, but I found out that she knows somebody very important that we work with on a regular basis. Grace Watford over at Henry Mayo.
Oh, I will not hold that against you.
Grace is the nursing director.
Grace is the nursing director of the behavioral health unit. She's kind of like my work wife.
And
I see her so much.
And the acute rehab unit. And that's our guest is Antonia.
Antonia.
I knew I was going to say it wrong.
Oh, you blew it.
I set myself up. Antonia. My apologies.
Antonia. I can't believe you did that, Mike.
Boyer.
You really blew it.
Yeah, thank you, Cary.
Oh, you're welcome.
It's not a common name.
But you did. You worked over at Henry Mayo for a while. And in your background, you've got like 25 years in mental health. And this is great because you're going to help us kick off May is Mental Health Month.
Okay.
And Cary and I are going to talk about what that means and how it got started and all that before we actually get to you. But we're really looking forward to talking to you. In fact, you ran here from your office that you have here in Newhall, right?
Correct. Yes, it's just up the street.
She thought she was late, and she came running in on Dr. Palucky's show. She thought she saw you in here. She thought it was, I'm late for the show.
No, that was classic because I knew what you were doing, and I just kind of smiled.
Wonderful to have you here, Anthony. And
Thank you. Thanks for having me.
Oh, it's going to be a great kickoff to May is Mental Health Month. Cary, we already talked about this for a quick second, but it's just so important. I just wanted to bring it up again as an action file item. According to the CDC, the Center for Disease Control, every 19 minutes, someone in the U.S. dies from an accidental overdose. And so that breaks down to literally, it's 3.15 people per hour. So that means in the hour that we do this show, 3 people are going to die of a drug overdose. Isn't that sad?
This just came to me last night. You want to read this?
What do we got? Okay, you want me to read?
Yeah.
Can I read the first name?
Yeah,
Sure. Lacey shall be forever present. Her voice sings within the gentle breeze upon the day. Her smile radiates within the sunlight. Her eyes glistening upon the waves, cascading, embracing the shoreline. We shall now be released from the temptations introduced by others. Her beautiful spirit soars freely, chains released. She now will be within Summerlin of peaceful tranquility. Summerlin, land of peaceful tranquility. I take it that somebody has overdosed and left us. That's
every week I'm reading one of these. Yes,
you are.
I mean, every week.
Someone took the time.
I have more.
Someone took the time to pay respects with that one. Very beautifully written.
That's her mother.
Yeah.
It's really. But it's like every week I'm dealing with this. every day I'm dealing with this, but every week somebody's dying, and it's more than one.
It's a good thing.
It's just terrible.
It's a good thing action is there, Cary.
Yeah. I mean, this gives me the chills because it's so sad, you know?
Oh, well, our heart goes out to that lady.
Yeah, but like we said, by the end of this show, minimum of 3 people will have lost their lives to a drug overdose.
Yeah.
By the end of the show. I just did Dr. Palaki's show, right? So that's an hour show. This is an hour show. 7 people, 8 people will die in those 2 hours.
That's right.
In this country. That's an outrage.
It is an outrage, and people should be standing on the rooftops screaming to get it stopped.
Well, we're standing in a radio.
We are. We're
beautiful
screaming.
Downtown Newhall, screaming about it.
We have that powerful transmitter that's throwing that voice out there, and then we have Facebook and all that sort of stuff. Facebook. Well, that's that too. So another action file. And listen to this, Cary. Suicide rate on the rise. This brings us into May is Mental Health Month. Experts say rising drug use may be a contributing factor. Suicide in the United States has risen now 24% between 1999 and 2014. So we have 2 more years on it, so it's probably worse than this. According to a new report, this is, again, the Center for Disease Control and Prevention, and they're saying that there may be a couple of contributing factors, including the use of drugs, the increased use of drugs, and some economic pressures on people as well. Suicide is the 10th leading cause of death in the United States. The suicide continued to increase the first half of 2015. All right?
You know what we say? We say 47,000 people lose their lives from drug overdoses, right? That's just overdoses. We're not talking about car crashes, reckless endangerment, suicide. You put all that together, and that 47,000 is going to multiply, I don't even know by how many. But I'll tell you this, like it or not, a lot of those suicides, guys, are because of alcohol and drugs. I can guarantee you that.
Well, suicides also surged among middle-aged men and women, and, listen to this, the suicide rate tripled among young girls ages 5 to 14.
5 to 14.
Now, they are saying, though, the numbers for that age group are small.
Let's just say that, the numbers are small, but
we
have what you call an LPS designated hospital. Right. Meaning if somebody's suicidal or homicidal, they go to the Henry Mayo ER, and we have a mental health unit, a behavioral health unit, and we could put people on holds to protect them from themselves. Kid yourself not. We have 5 and 6-year-old kids coming into that ER that are suicidal that we have put on holds that go to mental health units.
That's right.
So it's not a game. It's for real.
Isn't that sad?
It's
Isn't that just
always
horrible?
sad when we have a child come in.
And I know that the people that do the assessments when they have to assess a child that age is just heart-wrenching.
Well, they call me because they call me on all holds. And there's a lot of times the nurses are in tears. Or the social workers are in tears. I have to put this kid on a hold.
What a sad thing. So suicide rates increasing. Oh my! Hey, Cary,
by the way, but let me just ask. You can jump into this. Let me ask you this: suicide rates are increasing, right? So we know people. I mean, what's worth dying for? What possibly? The only thing I could think of that would be worth me dying would be my kids. I would die for my children. But what else is worth dying for?
You know what? I think it's more just a sense of hopelessness that there is nothing more for me.
Right.
And so the alternative, suicide, is a better existence than what I'm living in currently.
Mm-hmm. Even though we know all bad things come to an end, and if we want it to get better, it will. And when we're feeling that helpless, hopeless thing, we just got to somehow remember it's going to get better. But I believe, here's what I believe. I don't believe most people, there are people that really do want to die. And they're not going to tell anyone, they're just going to do it, and there's nothing anybody can do. But I believe that most people that commit suicide or attempt to commit suicide really don't want to die. They just don't want to feel the pain. Mm. They're looking for some kind of an out, and they don't know what to do. So I guess the message that I want to give them, I mean, how does people get into Henry Mayo's mental health unit? We run it. How does it get into? What do they have to do to get in there?
Well, literally, they have to fit one of 3 criteria set by the state, by the way. And one is that they have to be suicidal with a plan. Mm-hmm. because the more detailed the plan is, the more possibility that they would carry that out. The next is homicidal with a plan. In other words, they are very, very seriously considering hurting people.
Right.
And the third one is a little trickier. That's called gravely disabled. And what that means is basically somebody really can't get through the day without help.
And the majority of people that come into our unit are suicidal.
Yes, they are.
And when I got there this morning, there was 18 patients.
Right.
One room was closed, so we were full this morning,
Right.
basically.
We were.
So that means we had 18 people on that unit that attempted to kill themselves or wanted to.
Or very seriously
and
considering
we're
it.
open 365 days a year, and the unit's almost full, always. And that means every day there's 18 to 22 people that want to die sitting on that unit.
Right.
And they don't. They don't die.
No.
They come in, they get some kind of treatment, they go home, and usually things work out for them. So what's the motive? What's the moral of the story?
The moral of the story is simply, well, in the case of many of them, they didn't go in there on their own.
Right.
But some do. Some show up in the emergency department because they need help.
Right.
But we save lives here. We simply do. And you know, to anyone that's out there listening, if you or someone you know and you believe that they need some help, even if they don't have a plan for their suicide, I'm going to tell you our emergency department is open 24 hours a day, 7 days a week. We never close. Get them in there because they'll be seen medically and they'll have an assessment of their mental health. Very, very important. The very least that's going to happen to them in there is that they will get referrals to where they can go to get help.
Exactly. And I guess what I'm trying to say is look at that. Every day we're full with people that really try to kill themselves, but don't, but didn't and don't. So there is definitely hope. And what we're trying to say is there's really nothing worth dying for. Whatever it is that you're going through, if you reach out and ask for help, there is people there always that want to help. You don't have to do this alone, and we know how lonely it feels when you're feeling that depression, and we'll talk more about that in a minute. Mm-hmm. But yeah, pretty scary stuff when we look at the numbers.
Cary, I've got something to read to segue us into May as Mental Health Month, and I think you've heard some of this before.
I can probably guess,
but it's been a while.
Yeah.
It's been a while. Antonia, I think you're going to.
You got it right that time.
Very interesting. Imagine the early days of mental health treatment. Asylums restrained patients with iron chains and shackles around their ankles, wrists, and necks. Okay? This was a cruel practice, and it was eventually stopped. Then in the 1950s, Mental Health America contacted asylums around the country and asked for their discarded shackles. On April 13th, 1956, at the McShane Bell Foundry in Baltimore, Maryland, Mental Health America had those cruel, inhumane shackles melted down and recast into a 300-pound bell that has become a sign of hope for the mentally ill. The Mental Health Bell has the following inscription: "Cast from the shackles which bound them, this bell shall ring out hope for the mentally ill and victory over mental illness." And by the way, the bell is displayed at the Mental Health America headquarters in Alexandria, Virginia. For 65 years, May has been Mental Health Month, and this year's theme is Before Stage 4.
Okay.
Which brings us to our guest.
It does.
Before stage 4, we think about things like people having cancer, and they'll say, well, it's stage 4, which means you're in big trouble. You always want to get it earlier. So the theme here, before stage 4, means we want to get some early intervention. We don't want to wait for it to be too late.
Correct. That's absolutely right. And what we're looking for, we want, just like, I would even make it as simple as the cold or the flu or something that comes on, a symptom that we can identify. Mm-hmm. Something, first you have the little sniffles, become something more, pretty soon you can't get out of bed, and before you know it, you're super sick, right?
Right.
And what we want to do is, when you first start noticing the signs and the symptoms, ask people to become aware and become, I want to say, proactive about getting help. And so for stage 1, I want to just explain, we have mild symptoms and warning signs. At stage 1, a person begins to show symptoms of mental health, but it's still able to maintain. But the ability to function at work and school perhaps are not really struggling at this particular moment, but there is evidence
It's
that
starting.
something
It's
is
starting to get in their way a little bit.
right. It's just a little, a little gnawing
Right.
at the moment. And that's a really great time to just go in because you're at the very early stages of it. But if you have flu, for example, even if you have the early stages, you're going to continue through.
Yeah,
There's
your
a
body
difference
starts
in this.
aching a little bit. You know
Yes.
what's going on. Yeah.
Right.
Yeah, but it's just like you said, even with the flu, there's medications now that if you go within 2 days,
That's
they
right.
can knock that flu out pretty quickly. If you wait, it's going to take a long time. You're going to
Right.
be sick for a long time.
Right, and you can rest, and there's other things that are prescribed that you can do. You don't want to rush out and get incredibly active and things like that. You want to let the body rest.
Of course.
And we want to learn how to manage our stress and strain when we're learning about when we begin to just notice the early signs and symptoms of it. And the second stage is it usually becomes obvious that something is wrong. A person's symptoms may become stronger and they last longer, or new symptoms may start to appear on top of existing ones, creating something of a snowball effect.
Yeah, and let's talk about depression just for a minute. I mean,
Okay.
everybody gets depressed.
Yes.
We all have bad days. Something happened at work. Our kids did something. Somebody hurt our feelings. Our husbands or wives did something. I mean, everybody has bad days.
Yes.
And everybody has a period of depression. And what we're talking about, there's different kinds of depression. There's regular depression when I had a bad day. Then there's a clinical depression.
Yes.
And what is the difference between depression and clinical depression? You want to talk about it, or?
Well, I would say regular depression, all of us, I want to call it, we have like a window of tolerance. So our bodies, and we go through ups and downs. That's a natural course. If events become too much for us or too stressful, and we're at the upper edge of that, we're more irritated and anxious and maybe explosive,
Right.
and you don't feel like you're in control, you're not in command of your being, right?
Right.
And so at the lower edge of that also, there is, if you get bumped down below that window of tolerance and you're not, like I said, and like we described, it going in that ebb and flow,
Right.
and you're below, then you experience symptoms of depression and you want to isolate. And that's really, the isolating is something that I don't want to be around people. I just want to be alone, be alone
Right.
in my pain and et cetera. So
Which causes more pain, by the way.
it absolutely does. And we don't feel like reaching out to other people. However, if it's clinical, if it's a clinical depression, it goes on for longer.
Right. It
And
gets
that-
in the way of our daily routine, our work, our family functions,
Yes.
and all that kinds of stuff. And when it starts getting in the way of your family functions and your work and just you being alive, you got to pay attention to that pretty quickly.
Right, and our well-being. When we're talking about mental health, we're really talking about our well-being. We're looking at it socially,
Right.
emotionally, and psychologically. And I would even venture to say spiritually, because
Of course.
we have all of those things that are part of our being. And if we have illness in one area, we have, we're a system, and it's going to
Right.
reach to other areas.
And when we're into that funk, and we're so depressed, we can't get out of bed. I mean, physically we're sick, emotionally we're sick, and spiritually we give up.
Yes.
If
Yes.
I feel this bad, why isn't God helping me?
Yes.
So God and all that kind of stuff is wonderful, but you got to do the footwork.
And to help our listeners to understand a little bit better, if you having basically a passing blue mood, in other words, you're down, things just aren't working, if that goes on for 2 or more weeks, you're probably looking at clinical depression. In which case, if somebody says, "Hey, come on, pull yourself up, take a shower,"
Mike, get over it.
yeah, get over
I
it.
mean, look what you got. How could you be? I mean, come on.
Exactly. But it's
Everyone should have it as good as you, Mike.
Yeah, but it's impossible for somebody to do that. They need help. They need a therapist such as yourself, and they may need some medications as well.
Correct.
And by the way, what I do want to say, which I always say when we're talking about that, if you're going to go to your doctor and get medication, you better be getting therapy too. I believe that medication without therapy is not a good idea.
No,
Yes.
because eventually you'll stop taking the medication, and you just won't be dealing with it.
You don't want to mask the pain, you want to deal with the pain. So there are definite reasons and benefits for the right medications, but you got to include some kind of therapy with that.
Absolutely.
So on that note, I guess it's time to take a break. So we will be right back. This is Families in Action on our hometown station, AM 1220 KHTS.